There's a lot happening with New Jersey's child welfare system. We want to help you make sense of it and share our story. This is DCF On The Air.
This is DCF On The Air, and I'm Jason Bukowski. Thank you for joining us today for our first repeat episode. We're actually repeating a topic that we covered last season, but we're giving a little bit of an update. We also have our first repeat guest, and I think I told her if she gets one more punch in her punch card, she's going to be co-hosting this thing with us. But I wanted to set this up a little bit. This school year, DCF launched a new program, NJ4S, New Jersey Statewide Student Support Services. The idea behind this initiative is to provide youth mental wellness and prevention opportunities to students and their families in school, in community, to make these services accessible in order to address the national mental health crisis. Last year when we talked about this initiative, we talked about some of the statistics, and they are overwhelming. I believe it's 2 in 3 girls are experiencing symptoms of prolonged sadness and mental health challenges. We're seeing increases in the rates of depression, anxiety across the board, and we know we need to do something. So in an effort to create a statewide approach and really focus our energies on how we can address all students in the state of New Jersey, we launched this program, NJ4S. So in the less than 1 school year that it's been active, we've seen some fantastic statistics about engagement with youth, with families. Thousands of families connected to Tier 1 services in the state of New Jersey. And evidence-based supports available for the first time in schools, and really connecting to the infrastructure that's already there. So we're not duplicating services, we're extending and expanding them. Joining me today to talk about this are one of our program leads, and she's the one that has some experience with the DCF On The Air podcast, and one of our hub providers who's on the ground working with us, and I'll turn it over to them to introduce themselves.
Well, thank you, Jason. It's great to be back with your audience. My name is Janera Hill, and I'm the Assistant Director of the Office of Family Support Services. And so our office sits within the Division of Family and Community Partnerships, right? So if you think about the department having many arms, we are the prevention arm. And so my office is one of 4 within FCP. That's the acronym that we use to describe connected to family and community partnerships. And so in our office, we do have family success centers. We have a number of programs, but we also recently launched the New Jersey Statewide Student Support Services, NJ4S, and I'm so glad to have Diane Travers with me. She is one of our leaders at one of our hubs in Essex County, and so I will pass it to Diane.
Thank you. Well, thank you for having me. As Janera said, I'm Diane Travers, and I'm a Senior Director of Programs at Family Connections, which is the managing agency for NJ4S Essex.
Great. So welcome to DCF On The Air, and thank you so much for taking the time to join us. I talked a little bit about this in the intro, but since launching NJ4S this school year, I'm wondering, how have we been able to integrate this network of services and hubs into the existing youth mental wellness infrastructure and the whole continuum of services? Go ahead, Janera.
I
don't typically have to call my guests, but we'll go with that.
Well, I wanted to really talk about like our reach, yes, right? Because we're so brand new, and we're like the new kids on the block. And so Diane and I were talking, and we were saying we launched last spring of 2023. So right when the school year was ending and right before summer. And so the really important thing was, buying any startup equipment, hiring your staff, getting leadership in place. the next big thing was like embedding yourself into the community.
Yeah.
And so they had no data system. And so the data system is like the starting point for schools to actually create an application and submit and the application to request services. So before that, it really was connecting and really embedding themselves into the community. And so getting to know all of the key players, right? And so when you're in a space where you're like the new kid on the block, you're kind of disrupting the ecosystem of services. And so people that could look like, well, who are you? I don't know what you have to offer. Come back in like a year or two.
Yeah.
It could also look like, are you replacing me? And so that's not what we're doing. We're there to complement and to help. And so I think they had to really be side by side with other key stakeholders and the existing providers to kind of understand what was there, so that when it's time to start going into the schools and like servicing students and families and making referrals, they already know who to go to and make the warm handoff to the right providers.
Sure.
I did want to share that since launching the data system in September, it was a slow startup to kind of get schools signed up into the system because you need login access to create an application. But once we got it rolling, there are 583 school districts that are eligible across the state for NJ4S services. Of that 583, 203 are categorized as high-need districts. And so currently, within the last 9 months of launching, NJ4S statewide has reached 50% of that high-need bucket of school districts that are eligible for services. And of that bucket, 80% are submitting applications and requesting services from their local hub. So they're really engaging people in less than a year.
Yeah.
So
no, that's fantastic. And I think that, so there's a couple things I want to touch on from there. The first is that, when we talk about this idea of how do we connect to the infrastructure that's already in place, it's not just the programs that are being delivered by DCF or state agencies or in community agencies, but it's all of it plus what's already in place at some of the schools, right,
Yeah.
Diane?
Yes, exactly. That's what I was going to say about integration is we even had to be careful at Family Connections because we have a number of programs that do work within schools. Mm-hmm. So we've got a drug and alcohol coalition, we've got outreach to at-risk youth program, and they typically have gone into the schools and work with youth. So we're always looking at what are our programs that already exist really within our organization, but also that are already supporting schools. Yeah. So some schools do call in extra mental health supports, hire kind of outside contracting agencies to provide mental health counseling for their youth. And so for us, I think it was first of all respecting that there is a system already in place and making sure that we check in with schools about what services that we have. But it was also really, I think, as Janira said, kind of that cautious, well, what are you all about and do we want to engage, was more about really, really marketing what we do. Obviously, no cost to any of your students, to your school, grant funded, and really having the schools just kind of buy in to see that there was room for so much more support. So in Essex County, we have 100,000 students who are in 6th through 12th grade in high need schools. So if you look at that alone, that's our target audience to provide services to. We know that that existing infrastructure is already taxed and that the demand for the services outweighs the resources that are available.
Yeah. Let's talk about the relationships that that our NJ4S hubs are creating. We talked a little bit about coming into a school and there being a little bit of apprehension. I don't know you. I don't know what services you're offering. I'm wondering, have schools and school administrators really embraced this program? And are there any instances that you can think of where maybe initially you might have been met with some apprehension, where the school district came in and said, well, we don't want this for our students, and then realized the value add, and that now they're some of our supporters.
Absolutely. I think this has been a slow climb in a sense, but now we've really gotten to a place where the more awareness we've created, our school administrators are absolutely on board. And I think the way we rolled out over the summer and presenting to county superintendents at their roundtable meetings and really trying to get the word out from the top down was maybe effective, but what became more effective was really who are the people that we're going to be working with. So we're going to be working with those directors of special services, those school social workers, those counselors. So after we created that awareness with principals, with superintendents, then came the work of really identifying those individuals who are seeing the needs that the kids have, seeing the needs that the families present with. And once we got all of those contacts in a row and started meeting with people, it was like the floodgates opened in a sense. People were really, really aware of how much these prevention supports were going to be able to assist their students, as well as the mental health support. So it was a lot of marketing, a lot of work early on, but we've, as of recently, I think we have maybe 16 schools left to engage, and that's been it. So
16 in the entire county?
Out of our 122 eligible.
That's
so
fantastic.
We're proud of that, but I think it really was a word of mouth. And the more meetings we presented at, and the more people kind of said, wait a minute, I didn't hear about this from my superintendent, but now we're at a director of special services meeting on a county level, and they were invited to bring one social worker along with the director. So here they were sitting in the room saying, we haven't heard about this. Come to find out, they might have already been signed up in NJ Connects by their school district, but they weren't even aware what we were doing. And once that word got out, then it was, can you set up meetings to teach us how to do applications? Can you tell us, send out your list of evidence-based practices? And from there, I think there's very few schools that are kind of saying, we're going to wait until next year, and more so that are saying, we want to get in on it now.
Yeah, and I do have a little bit of familiarity with Essex County. And I think I've talked about this on the podcast earlier, but my wife is actually a school psychologist in the Newark Board of Ed, so she works in 4 schools in the North Ward. But I know that Newark is unique in that they also have these resource officer positions. So they're really connected to families. Family needs help accessing a food bank. They're doing that through the schools. I'm wondering, are you connecting with those folks as well in your relationship building?
Yes. So I feel like there are so many titles that we connect with, but there are parent liaisons, there are student liaisons, there are family workers, community workers in the schools, and once we expanded to allow more individuals to have access to NJ Connects, we realized that there are a lot of roles where people, they're the ones working with families, they're the ones working with students. They can identify that. So even on our advisory board, we've got people in those positions, which is terrific because they're the voice of the parents, the voice of the students.
Yeah, and it's really about sort of positioning the school as the center of community.
Yes.
We know that, all of our kids go to the school, and if we're going to roll out, our main focus obviously is youth mental wellness. And I did correct myself at the beginning. I said mental health, and no, this is mental wellness, and I think that's we're going to get to that difference in a minute. But this idea of schools at the center of their community and serving the entire community. And I think that talks specifically to some of the services that are offered on the Tier 1 service line. When we think about the NJ4S services, it's 3 tiers, right? Tier 1 is our accessible to everyone, our universal supports in community. Tier 2 is our evidence-based, it's slightly smaller population, but it's still prevention services that can support anyone within that evidence-based population.
And I would think small groups.
Small groups.
For Tier 2, small groups.
And then when we think of Tier 3, these are the individual, brief counseling supports.
Yes.
Or
and
a clinical
interventions.
group.
Or a clinical group,
Yeah.
okay. So the idea there is that, brief temporary supports, to deal with a specific issue until you can get them connected to the larger mental health continuum.
Absolutely.
Let's talk a little bit about the Tier 1 services, because I think that's, as we're building up sort of our evidence-based programs and initiatives, I think that's, something that kind of comes, we had to be able to have access to the school, and those are services that are requested directly. Tier 1's offered regardless of whether a school requests it or not. This through partnerships in community, in school. How successful have those been?
I mean, if I speak just to our county, I think they've been incredibly successful in a lot of respects. I think the Tier 1 presentations have been, in a sense, an infomercial for NJ4S, because we get out there, we do a presentation, and here we are discussing all that the program has to offer. So we're informing parents, we're informing school administrators, school social workers, students. We have students who hear about it and go into their schools and say, is NJ4S in my school? I heard about this. So it's a very important kind of role in terms of just creating the awareness. But then the topics, I think we've very much identified topics that we offer on a regular basis, which are webinars. So we all offer evening Zoom webinars at 5:30 at night, in the hopes that maybe some school staff might join if they're getting home from the end of their day. But typically, we're really trying to reach the parents. So we did a whole series on substance use prevention. We called it Substance Use Prevention Deep Dive. We covered, vaping, marijuana use, fentanyl use, prescription drug abuse, edibles, all the things that we hear about all the time, but that we know our parents need to be aware of. In addition, we've covered the impact of social media on youth, cyberbullying, bullying prevention, raising resilient youth, which was a great one, giving parents tips for how they can improve that communication with their youth, increase the family bonds and the dynamic within the families. And then we've had Tier 1s that have been financial literacy, where parents are interested in resume writing, a financial literacy workshop as well. And then, of course, we've got a lot of professional development requests. So we're working with the entire school district to educate teachers, to educate school social workers, administrators.
Yeah.
Oh man, can I just jump in?
Absolutely.
My heart is just like bursting with like fireworks, because when this was just an idea with a few people working on it, that's exactly what universal supports is, right? You're informing people, you're sharing resources. And so we really wanted Tier 1 to be, how do we kind of expand our reach, expand the resources so that those that aren't eligible for Tier 2 and 3 services, they can still get the support that they need. It may look a little different. Maybe it is a webinar. Maybe it is just coming one time, doing a workshop, and then you're out. Maybe it is just sharing an article, but it's the idea that you can give the scaffolding to schools and to parents and community, just information for them to think a little bit deeper about a particular topic, or plant the seed for something. And then maybe they go and get support elsewhere within a community, or where they can get the support that they need. And so Tier 1, what you're saying, Diane, is just like awesome, because that's what we thought. So now it's happening on the ground. This is why this is like a part 2 podcast.
Yeah.
For listeners, Sandy, our assistant commissioner, he spoke about what we hope to do when we launch. Right. And I think Diane is really talking about what the hubs have done these past 9 months. And so that's amazing. In our data system, we're able to kind of see like a breakdown of how the hubs are providing Tier 1 services. And it's, resource sharing through fairs and events, also webinars, and the top one is in person, which goes back to the point of embedding themselves in the community and connecting with people, connecting with stakeholders, so that they can get their name out and really promote the resources and promote the services. So what Diane is speaking of, like what we see in the data system, is like in-person connection.
So, and really to add to what Janira shared, we've been partnering with a lot of Ys in our communities, in our high needs communities. So we partnered with their Healthy Kids Days, and we really left it up to the Y. What did they want? So most of the Ys wanted some type of interactional parent, kind of youth workshop. And at the Montclair Y, we were able to offer mental wellness for the whole family. Yeah. So families to come together to do little deep breathing exercises, to talk about the impact of stress, to give parents permission to take that time to care for themselves, to make pancakes for breakfast instead of for dinner, feeling the pressure of, getting dinner on the table after school and homework. And
pancakes for dinner is a good dinner.
Right. You know what? I know. I feel like you have to give permission, though, because a lot of people feel like, that's taking the easy way out. But you're right. I agree with you. Breakfast for dinner is always good. But so really, being in the community and working with families together. And this Saturday, we've got several events. We've got a mental health fair at one of our schools in Newark, and then we're at the East Orange Y, and we're going to parents are bringing their youth. So our prevention consultants will be working with the youth on these mental wellness kind of activities in a different area, and then the parents are going to be participating in a positive parenting workshop. So really, what strategies can they put into place to maybe reduce some of the harsh disciplinary styles and give them some new tips?
Yeah, no, I think that's fantastic. And I mean, when we first started talking about NJ4S, it was, this is going to be a support for students and their families.
Yes.
And to hear that that's happening and the way it's happening, I think really does drive home that this is the right approach. That, we're building up a supportive bubble around students, not just in school. It's not just, let me go to school and talk about my feelings, and then I can go home and mom and dad are too busy, or they're dealing with their own stressors or their own traumas, and they can't provide that support that I need. But when we're lifting everybody up in one direction, in this idea of creating a total ecosystem of support around the student, I think that's how we address the youth mental health crisis. That's how we get people access to feeling okay about and feeling supported and feeling safe and emotionally safe.
We're changing the landscape, right?
It is. It is
reducing the stigma.
Mm-hmm.
Yes.
Is it a bubble, or are you pulling a thread, right? Because I think about, there are programs that focus just on the student or the child, but then with NJ4S, it's like we're pushing. How do we then take that message and take those coping strategies that you may be teaching in a workshop and give it to and share it with a parent or a caregiver to help support that child when they're at home, or even for them to tap into when they're needing to pull their family or themselves through a crisis, or stretching it a little bit beyond, passing it along to community, because it's everyone's job to take care of each other, or making sure that children are safe. And so that when they're going out into the community, you're recognizing things and you know who to tap or who to call and what resource to go to. And you can help your friend or neighbor do the same thing. And so I feel like with NJ4S, we're going beyond the micro, and we're going
building bigger.
Bigger to family and to the community.
Yeah. And I think of, in child protective circles, we talk about this idea of intergenerational trauma and how the trauma from one generation goes forward 7 generations. That encodes itself in the DNA of the family. But this is intergenerational resilience. This is building up the assets that people need in order to cope with these stressors, because there's so much stress in the world right now. And we can't change that, but we can empower ourselves and our children and our students and our families to be able to deal with that in a way that is resilient and strengths-based. And I think that's sort of what we're looking at here.
Yeah, I mean, just mentioning trauma, that was one of the biggest needs that came up in Essex County. Our teachers wanted more information about the impact of trauma on students, and our parents said the same thing. We want to understand, what does that look like? Because I think, for so many, it's kind of, we're looking at, why is this child not sitting still? Or why is this child not able to concentrate? And we're not taking in that whole picture of what has actually happened within the family, within the community, sometimes within the school. So one of the first things we did was we identified an evidence-based practice that could be run by our prevention consultants called Supports for Students Exposed to Trauma. And not only exactly what you said, does it teaches a student about the impact that trauma has on them, but it also gives them those strategies for resilience. How, once you recognize it, how do you deal with it? And really highlights the strength that so many of our families and our students have, even though they're impacted. And then our clinicians were trained in cognitive behavioral interventions for trauma in schools, which is a very small group, as Janira said. Tier 3 can be clinical groups as well, 4 to 6 students in a group. It doesn't have to be a shared trauma, that happened within the school or the community. The students could have very different experiences, but again, it's supporting them around those experiences and giving them those tools to deal with it after. And we added on a module on racial trauma because we know that our students are impacted by racial trauma every day.
Absolutely. That's great to hear. No, it's not great to hear.
It's great to hear that we did it,
not
great to hear they're impacted, right?
Let's be clear about that. But as we were talking about the programming, especially with the Tier 1 services, but really across the board, and talking with the local YMCAs about what do they need, that also sparked in my mind that one of the strengths of this program is really about how do we incorporate that local voice.
Yes.
And the idea of, being led by the people in community, having them direct us as to what they need. And I'm wondering if you can speak to the experiences kind of connecting to that local voice and how is that really being reflected in Essex County?
I mean, that's a really great question because I think it happens on so many different levels. And so early on when Janir was sharing about we're ramping up, we're buying equipment, we're hiring staff, really my main role was how do I create that awareness within all of the systems that are already out there serving youth. So it was, having meetings with DCP&P and with the Human Services Advisory Council and the Juvenile Justice Commission and going to the kayak meetings and talking to everybody at the CMO and CSOC and all of that. So we were doing that work. But, a lot of what we were really doing behind the scenes as we were building our advisory board was identifying who are the most important people at this table. And while we definitely think our community experts are invaluable as our spokespartners are, we felt like our parents and our students need to have that voice.
I was waiting for you to say that.
What should this program look like from their perspective? We have 4 students on our advisory board, and we have subcommittees. So they meet individually 2 months, and then every 3rd month we come together quarterly as a big group. But our students are amazing. They've done things like set up meetings with their principals and said, why don't we have NJ4S yet? I haven't seen a single group. We've had students who have said, wait a minute, I would attend a group before school. You should make hours, your hub hours to be starting at this time instead of this time. And very much telling us, this is what we see in our schools. So without that, and as well as our parents saying, this is what we see our students, struggling with, these are the areas we feel they need support, without that real local voice from everybody, those experts in the community, those Y providers that provide the after-school care and the summer camps, all the way to some really innovative team programs that take place on that level, to our family success centers, to our other community providers. So very much having everybody kind of have a seat at the table. And that advisory board was critical in really helping inform us what we needed to do.
Yeah, and I think thinking specifically about the role of youth voice in that we've seen it at least within DCF, and we started to engage the DCF Youth Council about some of the work that we do. As soon as you open that door, they are going to have ideas, and they are going to knock down the door and come rushing in and share all that.
Yes.
And I think that's sort of the fantastic thing working with youth. They're not in a place to say, well, this just can't happen.
Right.
We can't do this. We couldn't possibly change a paradigm or do something different. It's like, we need this, you do it, and we'll help you figure it out.
Yeah.
That's really kind of, and it's energizing. It's so
absolutely.
energizing. Sometimes exhausting, but very energizing.
Yeah. I think back to when before launching and doing the RFPs, right? So agencies, we have the funding, and so agencies have to, if they're interested, write proposals and submit them to the department. And then we internally have to create teams of people who will review these different proposals and talk to each other to kind of decide, is this an agency I would want to actually implement the program and have it in my community? Do they have a track record of doing this type of work? And so what Diane spoke about was like building local advisory boards within the community, within the county, but as a department, and forgive me if you are watching because I have my notes, we built a very diverse RFP review team. We had not just like FCP from with our division staff reviewing. We had staff members from the Children's System of Care, staff providers from the Children's Interagency Coordinating Councils. We had parents, right, tapping into our Office of Family Voice, as well as connecting with the Department of Health. They have a youth council as well, and they gave us some names of youth that actually participated on the review teams, as well as the Department of Human Services, all help to kind of review the proposals and help identify our managing agencies, the folks that are actually doing the work. And so really, I know what you mean by it's exhausting, because as a system, you have a tendency to have your deadlines and a timeline, and you have to hit those dates, and you kind of go full steam. But when you're working with community and when you're working with families, you have to slow down. You have to explain what the process is. And so I would think that we had really good team leads within our department leading the conversations and like explaining, this is what you need to review. This is what we're going to be asking. So come prepared. And like, if you can't show up because you have to work, this isn't your job. If you're a parent or a community member, how else can you give your insight? Maybe it's writing, or maybe it's another special meeting that we have to hop on outside of what we've normally scheduled. So that, we not only talk the talk, but we walk the walk as a department.
Yeah. And I think we're often the experts in the services and programs we put out the door. And we know, and we were talking a little bit about this before we started, about this, the alphabet soup, all of the different acronyms, and this vocabulary shorthand that we have to talk about the services that we offer. We're experts in that, but we're not always experts in what does this community need right now? What do these students need right now? And so being able to bring those experts to the table and pair that with what we know we already have or what we need to provide that we don't have, that's been really powerful. And I've seen that across a ton of different programs at the department, but I'm glad to see that at NJ4S as well.
If it's not alphabet soup and talking gibberish like in letters, we have a tendency on the state level to think of like very fragmented, this is our program, right? It sits in this office or sits in this division, but families experience it as a whole. And so seeing what Diane, what she's talking about in her work, making it seamless for families, right? You need this is where you can go. This is a number that you can reach. Not fragmented pieces of a program. It's all a continuum, a pathway for families. And NJ4S is that connector for school faculty that are sometimes overwhelmed with what issues that students are coming in with, families are coming in with. And so this is just another support to kind of help bridge those community resources and the students and the school.
Great. So, putting on my director of communications hat for a second, the idea of outreach and relationship building and getting the word out, that's, something that I'm very passionate about. It's something that I do here, pays the bills. But I'm wondering, and you mentioned, the students kind of talking to the principals, advocating for the program. Engineer, you mentioned about the community health fairs and community festivals and getting the word out that way. I'm wondering what other, and I know Essex County does this really well because we've had conversations about this, but what are those other innovative approaches that the hubs are taking to get the word out about this program? Because there is a learning curve, and it's building up people's trust in this program.
Yes. Yeah, so I think it was really all hands on deck. We used every single role within our program, from scheduling coordinators going out to schools and sitting with staff and having computers to say, this is how we get you signed up in NJ Connects, this is how you submit an application, to our prevention consultants, even our clinicians early on, going door to door to schools, showing up with packets. Here's a list of all of our evidence-based programs for our Tier 2 prevention groups. Here's a list of the things our clinicians are trained in. Here's a description of what each tier is. Here's our parent education workshops. Here's our professional development workshops. And doing this marketing on every single level, and just kind of creating that, what is this program? I might be interested. And I think what we saw from there was, well, would you be able to come and talk to our social workers? Because they're the ones that need to know more about this. And even our advisory board members, my committee, are the spokespeople. So they're directors of social work, they're student assistance counselors, they're directors of student services, supervisors, and they're very much the ones that are going to go back and talk to the social workers about NJ4S. So in working with them, what might work, how do we get the word out, we decided to schedule a drop-in informational session. So what we really wanted to do is look at the schools that hadn't yet engaged yet, or really hadn't even signed up yet in NJ Connects, and invite them to stop in just in the afternoon during their school day and kind of do one-stop shopping where they could go to the table and sign up in NJ Connects. They could stop and talk to our prevention consultants, learn about the EBPs, go next to the clinicians, learn about that, go to our data analyst, learn about our outcome measures, learn about our summer services survey to say we're a 12-month-a-year program. We would love to provide services in your school if you have a summer transitional program. So really doing those things to really engage, the school people so that they had the buy-in, but really just to help them understand the model. Because I think it is when you break it down, you think, oh, that's simple. But when you see it on a brochure, people are like, wait, what is this? What's the difference between Tier 1 and Tier 2? Yeah. And wait, how long is Tier 3? How long can your clinicians work with them? And so really just being face-to-face, answering those questions and getting that buy-in from the schools was so important.
Yeah. Now, I'm wondering, because Family Connections has a lot of different programs, have you seen this kind of marketing push, or have you had to participate in this kind of marketing push for some of the other programs?
Never in my career. Wow. So it's the first time I've had a marketing coordinator, right? Obviously, our agency has a director of advancement, and she's got an assistant who, they're responsible for the social media for Family Connections. But to have our own person to sit down and say, okay, what should we do? How should we get the word out and listen to creative ideas like, why don't we do 1 or 2 minute little interviews with our prevention consultants where they're just very succinctly saying, this is what this EBP is. So people can click on a little link, we can email it out, and they can say, oh, wow, they've got a grief support group, and we've got students who are struggling, or wow, listen to this one that targets social connections and isolation with youth, and really get to know those EBPs. One of our advisory board members just suggested a more detailed index for the school social workers so they could look at what are all the lessons within these EBPs to help them select the best one.
Now, EBP, evidence-based.
Yes. There's that alphabet soup, right?
Yeah. Just wanted to.
All right, so now we got it out there. We can say EBP.
Yeah.
Okay, good.
Yeah, that's when you're writing a press release, the first reference is
say it first. Put it in parentheses. Yes, absolutely.
But that is really great to hear about that. Yeah, this is it's an exciting initiative, and that we can get the word out in ways that maybe we hadn't previously. Social media I think is huge in this way. So that's great to hear that that's how you're tapping into it.
Yes.
We talked a lot about building those trusted relationships with school administrators, with school staff, the people that are connecting to the services to request services. And we talked about how youth are directing services. I'm wondering, how are youth embracing these services? Do they seem to be, receptive to it? Are they listening? Are they participating? And are there things that we maybe should be considering that we're not doing right now, or that we could do differently to start to reduce the stigma around accessing services around mental wellness?
That's a terrific question, because I think we've seen it play out very differently depending on the school. And some of our schools have been so creative about how they really market the services to their youth. So in particular, right, we understand that a lot of times schools are very reactive, right? We've got a student who's engaging in a lot of physical altercations. Mm-hmm. There are a lot of problems. Maybe, they're meeting as a group and trying to identify, and they say, okay, let's form a violence prevention group and let's, refer these students. Well, that student's probably not going to have a whole lot of buy-in. Mm-hmm. So one of the things some of our school partners did early on that we thought was great is invited us out to almost do a little presentation on what this group is to the students, and make it fun, make it engaging, listen to them, make them feel seen, make them feel heard. And what we found was we did this in particular with one of our programs, which is called Safe Dates, and it's obviously a teen sexual health program that also looks at keeping students safe from intimate partner violence. So the young ladies that were originally referred to this group said, we don't really want to pursue. This isn't interesting to us. Yeah. So our staff member went out, did a really interactional presentation, and guess what? They all took the consent forms home and came back, and the group is now operational. So I think sometimes, we look at these models of, what do the students need? Let's plug them all in the group, versus let's talk to our students and find out, would you be interested in this? And would you be willing to give it a shot? Would you go for the first week and see what it's all about? And we show up with fidget spinners and, cool NJ4S pens, and we're looking at, other little fun things like little whistle keychains for safety, and just a way to kind of say, hey, could you give it a shot? And then when they're seeing our staff and they're feeling that mentoring relationship and the connection to that caring adult, because we know one of the most important statistics about suicide prevention is one caring adult involved with a youth. That could be the crossing guard. Mm-hmm. That could be the woman that's serving school lunch, but that person that sees that youth, that hears them. So for us, having that relationship that the staff build, both in our prevention groups and our clinicians, has been invaluable. And what we've found is, if you look at our no-show rates for the clinical services, unless a student is sick or absent or involved in testing, the students are texting the clinicians, hey, I'm not going to be in school 11 o'clock on Tuesday. Can we change it to another time? They're so engaged. Yeah. And then our youth in the groups are actually so excited to be engaging with their mentors. We had a really bright spot. We have 2 male prevention consultants that are providing an evidence-based practice called the Council on Boys and Young Men. Mm-hmm. And what it really does is it looks at young men and youth who identify with male development, and looking at really the mixed messages they get today. Toxic masculinity, what is social media saying? Our youth of color, you can't cry, you've got got to be strong. Crying is for girls. So how do we kind of, empower them to really embrace their male development and to have that self-esteem, which by participating in this group will then impact the at-risk behaviors. If I now feel a part of my community, my school, if my voice is being heard, maybe I'm not engaging in some of those risky behaviors I might have been engaging in before. So in this particular group, it was the very first week, and it was sixth graders. So with sixth graders, it's key to get in with the sixth graders. That's a great place to start. The younger, the better. But you also know the attention span. So one of the youth said right away, how long are we going to be here for? And our two prevention consultants said, we're going to meet for an hour. And he said, no. I mean, how many weeks? And he said, we're going to be here for 12 weeks. So we're going to be here once a week for 12 weeks. And so he started thinking for a minute. And he says, oh, wow. He said, I'm going to be able to spend 2 whole days out of my life with the two of you. And right away we knew. And this is the group that when they show up, these young boys run up and they hug them, and they're so excited that they're coming. They don't miss a group. They're all ready to go, and so it's a really great thing watching those relationships and knowing that relationship is so key to the youth really embracing whatever's being taught in that group.
Yeah, no, I think that's great to hear. We talked about this at the beginning, and I said we were going to get back to it, but this idea of mental health versus mental well-being. And when we talk about NJ4S, I try to be conscious, and sometimes I screw up, like I did at the beginning of the episode, but I try to be conscious of talking about mental well-being when we talk about NJ4S. And I'm wondering what that difference is for each of you. I know what it is for me, but what is that difference for each of you? And how is NJ4S part of the larger continuum of both mental wellness and mental health care?
Want me to go?
You're on a roll.
So I think, mental wellness is something that's important to every single person, right? We hear the statistics about stress, right? We look at what's happened since COVID. We look at so many challenges that we're dealing with, in the world, and we know that everybody across the board is impacted. But I think, when we always have these kind of mental health diagnoses and, we're looking at mental illness, right? That's where a lot of the stigma comes in. But when we do talk about mental well-being, just as you would care for yourself physically, get enough sleep, eat the right foods, get some exercise, get outside, all of those things. We're looking at what is that part that we neglect the most, right? We neglect our mental well-being. So one of the things we also saw from our needs assessment early on was that our teachers and parents both said, we're stressed out, we're struggling. And if we're struggling, then how do we kind of, go into the school and put our best foot forward? So we trained all of our staff in mindfulness, stress reduction. And so they can offer a workshop to parents, they can do workshops to teachers, they can go out and do it with students, but also they can infuse that in every discussion. So even if they're running a group on social connections and peer relationships, or if a clinician is talking one-on-one with a student in a session, they can infuse those principles of how do you take care of your mental health? How do you become mentally well? And how do we not neglect that part of that dialogue?
Great.
I would say, thinking from where we are in FCP and like the department and the different divisions, if we think about a continuum or a pathway, if we want to be very simple, not everyone is going to be on the end where you need intensive clinical services, where what you're experiencing can be diagnosed. There might be individuals that are experiencing sadness and grief, and it's for a particular season. And so that's where prevention, early intervention is needed. And I think that's where NJ4S falls when we think about the continuum or the pathway that I'm talking about. Sure. And so, again, NJ4S is not here to replace all of the existing services, right? We have a whole entire division that does the behavioral mental health services for children. And so NJ4S is not replacing that. And so if we do meet students or family that need that referral, we know where to kind of make the connections. And I think what Diane was saying, just being mindful of how small practices and strategies can be implemented to kind of just take care of yourself. Being mindful of other social factors that impact your life, right? That it's not just about the individual, but if they're dealing with food insecurity or they don't know where they're going to sleep, that impacts how you're going to show up to work, how you're going to show up to school, ready to learn or not. Mm-hmm. And so just taking into account all of that information and how we can help support the family and the student in order to make sure that they're well.
Yeah, and I think it's, that acknowledgement of, the sadness today left untreated, left connected or unresolved will become depression tomorrow. Yes. Or could potentially become depression tomorrow. And this is about how do we, have those interventions, those strategies, the coping strategies, resilience, so that we're building that up so that hopefully, we have fewer entries into more of an acute clinical therapeutic setting because we've addressed the issues up front and in a way that will ensure better outcomes too for the youth.
Yeah. We had one of our larger charter school, it's considered a district for us in Newark, and they've got 6 schools that are eligible for services, and they asked for a 20-minute presentation on test anxiety because the students were just about to have their standardized testing. And what we're doing is we're normalizing, right? We all feel anxious when something big is happening and giving them strategies about, how to prepare and how to sleep well and kind of the mantras and the self-talk and the positivity and really giving students not only the language to be able to say, okay, other people are anxious as well. It doesn't mean something's wrong with me, but these are some little steps that I can take to kind of deal with that. But again, hearing that, hey, a lot of other people go through the exact same thing you're experiencing.
Yeah, normalizing emotions.
Yes.
Because we're often told, if you're thinking that, you're different. You're abnormal. You're being crazy.
Or it's the rite of passage. I went through it, so it's time for you. That's just a part of growing up, or that's what you got to go through in order to do X, Y, Z. So yeah. And so now it's like, if you break a foot, you do certain things to heal. If you have an open wound, you do certain things for it to close up and heal. And so now we're talking and working the same way with our mental well-being. Yeah.
No, that's fantastic. So that's one lesson learned.
Yes.
That's one big lesson learned.
Absolutely.
I'm wondering what are some of the other lessons, in this first, how many months has it been? 9 months? Mm-hmm. So we've carried the baby to term. What have we learned along the way? What are some of those things that have really stuck out to us? And what comes next? Where are we going from here?
So we like to say our guiding word this year has been flexibility, because what we may have thought this was going to look like, it may have kind of gone off the exit ramp and it went in a slightly different direction. So for example, we've got 32 prevention consultants, 10 clinicians, yet 75% of our applications have been for the mental health counseling. So we have our clinicians, we have our scheduling coordinators when they see an application saying, oh, I see this school has made several applications for youth who are experiencing depression. Well, we've got a group called the Blues, which can be implemented, and trying to really, again, advertise we can reach more students for a longer period of time in our prevention groups and really getting the word out about prevention. So flexibility, absolutely. absolutely. And then we've said patience too, because I use the analogy, if you build it, they will come. But I guess it was too old of an analogy because nobody had seen the Field of Dreams when I shared that. Okay. But,
Well, now
but the whole piece of it was we did build this, and then we were all kind of sitting back saying, okay, let's go get those applications in. And we realized that it was through these Tier 1 presentations, or sometimes just a Tier 2 presentation, in a particular school, to, kind of, again, use that as a way to not only inform and educate, but to market what NJ4S is all about.
Yeah, and I think too, especially in your first year, the number of people just saying, well, we need mental health.
Yes.
We need mental health. We need mental health. They know they need something.
Right.
But they don't know what that is.
Yeah.
So it's easy to say, well, we just need more psychologists. We need more counselors. We need more therapeutic, clinical, because you're jumping to that because you don't know that there's a whole continuum of services available.
Exactly. And I would also say you're in the thick of it. Mm-hmm. Coming from putting myself in the shoes of a faculty member. If I'm coming into work, it's just overwhelming to deal with the needs and the issues that students have. And so you're just like, I need to do my job, and I need you to come in and just deal with this.
Yes.
And so you, like you said, you think, well, counseling. I have this student counseling. And so I'm like giddy right now because I'm hearing Diane talk about like, oh, well, we see these applications, let's group them together. Yeah. And like really crafting that message that prevention, help doesn't always have to be the one-on-one traditional talk. And so I think the next step moving forward is to continue to have a strong crafted message that prevention can look like other ways. Help can look like XYZ, what the hubs are doing. And so that's one thing. But also like seeing the collaboration on different levels. We, my team, right? April, Lee, Sukanya, Brandy, Natasha, those are the program leads that like support the hubs, and like they're going through the reports and they're like, okay, well, there's an application for one-on-one, but it's from the same school and it's for the same service category. And talking with the hubs, like encourage the schools to group them, right? So we can kind of see a shift in our data in the system. And right, you're hearing it, the work that's happening on the ground. And so that's like a really cool just collaboration that you're seeing. And so I think crafting different messages moving forward to show people that, yep, help looks different. That's one. But also if we're thinking about the stigma of like systems in the community that have often like railroaded community members, this work is different. And like we're partnering with each other on different levels, different state agencies to help support students and their families. And so I think showcasing that is an important thing too.
I love that you touched on the cultural piece as well. I mean, we've got, out of our prevention consultants, 7 are bilingual. They speak Creole, they speak Spanish. We've got a clinician who speaks Portuguese. Those were our top languages identified by our census. But it is this piece of, we were interviewing staff who were saying, oh, I grew up going to the Newark schools, or the reason why I applied to Essex is because this is my home, this is my community. And then those very staff members are going out and relating to these students and saying, hey, when I was in school, so all of a sudden, again, we're watching the layers of that stigma. It's not that you're weak or you're misbehaving or externalizing behavior, so you need to be in this group. It's that so many things are impacting, student success in school. And if we don't reduce some of those barriers to just allow them to concentrate and be fully present, we're not going to be able to get down absenteeism rates or poor test scores or things like that.
I think that when we think about sort of the direction that we're going in, it's that changing mindset. It's that, help doesn't always have to look this way. And, there's other ways where you can access the help. And, ultimately, it's changing larger outcomes and across the board. Test scores, absenteeism, all of that, by creating community, creating a sense of well-being, having this larger, and we talked about it a few times now, ecosystem of support for students. And I think that's the strength of NJ4S.
Yes.
And I really thank you both for all of your work to build up this program in the first year, and I can't wait to see what comes next.
We can't either.
Yeah.
Thank you for having us.
Yeah.
So there you have it. If you're tuning into this podcast and you are a parent in New Jersey or you're a school administrator in New Jersey and you're saying, this sounds fantastic, why don't we have this yet? There are ways for you to be able to access NJ4S. There are ways for you to get connected. The first thing I would suggest is go to nj4s.nj.gov. Look at the online portal. I believe the Tier 1 services are included there, so you can access those in community supports. Do we also have the link for schools to sign up?
There's a SurveyMonkey link
Yes.
that goes through a county's hub.
Okay.
So if you reach out to the hub, they will give you a SurveyMonkey link where you can drop down and identify your school and put in all of your school reps that you would like to have for your school. Each eligible school can have up to 8 school reps.
Yeah, and I believe the hubs are all, the contact information for the hubs is all on the NJ4S online portal too,
Yes.
right? So if you don't have this program and you're saying, I want this for my students, go to nj4s.nj.gov to get that. Next month, in the idea of sort of changing our mindset, we're going to be inviting some of the program team that's working on family preservation services. So June is reunification month. This is where we celebrate those families that have done the hard work, that have maybe had sort of a challenging experience in the past, but they've done the hard work to engage in healing and have been able to come back together. Part of that and key to that is the services that we provide through the department to keep that family connected during and out of home placement. And so we're going to be talking to some of our program staff that are working in that specific area, and there's really innovative and creative things happening there too. But whether we're talking about innovative programming that supports youth mental well-being or the bonds of family, all of it speaks to the transformation of DCF and the work that's happening to help all families, all New Jersey residents, be safe, healthy, and connected. So on behalf of the Office of Communications and Public Affairs and my producers, this is Jason Bukowski signing off, and tune in next month for more DCF on the Air.